Hello, everyone. I'm Dr. Rani Samuel, clinical psychologist and author. And today I want to speak about your trauma reactions. Right now in the world, on a global scale, and also in the personal scale of your life, trauma is happening and it's happening to you and me. It's so important that we get to identify the symptoms of trauma so that we can treat them accurately. Most people brush off things and say they're just having a bad day. That is true if your symptoms are simply once off, but for most people, they are not once off. So if your symptoms are lasting anything between 3 days and 4 weeks, we call that an acute stress disorder. So remember, 3 days to about a month. Then we've got to take it seriously. If your symptoms persist for more than 4 weeks, we are now coming into the territory of post-traumatic stress disorder. And this needs to be treated. It needs to be properly diagnosed, because if you don't treat it, actually if you don't even treat the acute stress disorder, we can have very long-term post-traumatic stress disorder. So there's a lot of common traumas. So of late, there's mass trauma. There's things that happen nationally. There's things that happen globally that affect a large number of people. I mean, if you look at earthquakes or flooding that's happening in various parts of the world, entire communities and entire regions are going through this trauma. But it could be something more individual to you. It could be failing an exam, losing a job, being involved in an accident. You could be a victim of a robbery, a fire, an assault, any number of things. Remember that even when you are a witness to trauma, that traumatizes you too. And of course, at a deeper level, unresolved childhood trauma just keeps on playing itself out over and over again. One of the first ways to assess whether you are struggling with trauma or not is to look at the physical responses that you are having to everything around you. One of the first ways we judge it is by what we call hypervigilance, which means that you are always on alert. You are looking over your shoulder and you are waiting for danger. So you are scanning the environment. It's like the world is a dangerous place 24/7. And many times this could just be false alarms. But because your nervous system is on high alert, you are consumed by fear and anxiety. Without a doubt, the area that would be severely affected when you are traumatized is sleep. You could sleep too much or you could sleep too little. And as part of that sleep, you would experience nightmares and repetitive dreams that will be all-consuming. The other thing that people that are traumatized do, and I'm not sure if this is you, but people cocoon, they withdraw from everything that used to be really fun for them, that used to be engaging, and they would withdraw to the safety maybe of a bedroom. A lot of people will engage in lots of online activity because it has the appearance of being part of the world, yet you do that from the safety of your room. So the key thing here is think about yourself and what you are avoiding. If you are reluctant to engage with the world, and if your anxiety is high, and as I said, if it lasts for more than a month, this is indeed a very serious condition. Another category that we need to look at is called intrusion symptoms. I was recently treating a man who had lost his wife after a long illness, but she was quite young. She was in her late 40s, and she had spent a lot of time in hospital. And what he started to have is what we call rumination. It's like the information and the memory was going around like a loop in his head. And he kept on going through the last conversations he had with her and wondering whether he could have said things differently. And he couldn't get out of this loop. What he was also having was repetitive dreams, terrible dreams of her suffering, of her lying in ICU. And these dreams would often happen around 1 to 2 a.m. in the morning. He was overwhelmed by flashbacks and traumatic flashbacks of her taking the last breaths, of her being put in restraints because she was very irritable towards the end and pulling out the tubes. And this traumatized him severely. And what I want you to know is that trauma really affects people at night. And during the day, somehow we are conscious and we can choose our responses. But at night, especially in the early hours of the morning, you can't really fight those symptoms. I often wake up in the morning just before I go to work, and I put my work phone on, and I would see messages at 2 and 3 o'clock in the morning from patients, especially if they're dealing with grief. And recently, I received a video from a patient, and her mother had recently passed away, and she was playing the video clip of her mom's last birthday, and she just sent me a message, "I miss her." And that's what trauma can do. And it's a very complicated grief that this patient is going through. So please understand that these reactions are quite normal, and it's pointing towards you being healed. Most people tell me they feel like they're being pursued all the time. It's like there's a predatory pack on them. And that's actually quite the key trauma response. You feel you can't settle, and you feel you can't rest. Let us now talk about the emotional reactions to trauma. I was in ICU not too long ago, and I was helping a patient to say goodbye to his sister. She had suffered severe kidney failure, and she was very young. She was 32 years old. And he was really struggling to say goodbye to her, as it was just the two of them that lived together. Their parents died in childhood. And he was filled with anxiety and panic, and that is a very real response to trauma. So he kept on being triggered by his 5 senses. So whenever the very sight of her would trigger him, the smell of ICU, hearing the nurses and doctors rush in and out of her room, looking at the machines bleeping. And this became one of the strongest emotions that he experienced, and it was all trauma-based. So the other thing that happened, he started to get very angry, and he would pick fights with the nursing staff. On the one hand, he was extremely grateful that they looked after his sister, but he became very irritable. And a lot of that was about why should such a young person, his only person in life, be taken away at such a young age. And while he was angry on the one hand, he would vacillate and then become extremely sad and tearful and overwhelmed, to the point of feeling like it's not worth living. His grief had overtaken him. What he also experienced, which is a trauma response, he felt a lot of guilt. It's like, why should he be alive? And he was just a few years older than her. Why should he be alive and she was dying? So he had what we call survivor guilt, and this was a trauma response. The more frightening thing that was happening to him is what we call dissociation. It was almost like he was separating from reality. He was becoming very numb and detached. It was almost like he had a helicopter view of what was happening, and it felt like he was not in the room emotionally, that he was just standing there, but his mind had left the room. And this was a very frightening symptom, because dissociation can often lead to suicidal ideas. And all these emotional reactions had to be deeply processed in therapy. Let us now talk about how trauma changes how you see yourself. This happens to everyone. I was treating a patient who was very young and going through a divorce. And at that point in time, she began a relationship with the lawyer that was looking after her case. And he did take advantage of her because he was very much older. And he said to her very clearly, if you agree to have a relationship with me, I will take care of you and your two children financially. And when going through a divorce, many women feel very vulnerable financially. And she had consented to this relationship, not really knowing what she had consented to. By the time I saw her, he had returned full-time to his wife and family, and they were aware of this relationship. But she was shunned by everyone and made to feel like some sort of gold digger because he was a very rich man. But he was someone that was very much a predator, because this was not the only relationship that he was involved in over the years. He had basically moved from relationship to relationship with women that he saw as vulnerable. But what happened to her was very sad, because her trust in people was severely eroded. She felt she was blindsided most times, and she would say things like, I didn't see that coming. For example, during COVID, he returned to his family and left her alone on the outside. And she felt like, how could he do this? Yeah, so vulnerable. But he took care of himself, and hence trust in everything and everyone became eroded. She saw all men and all people and the world as an unsafe place to actually engage in relationships. What also came with that was a loss of confidence and feeling naive. Because for the first time, she said to me, now I know that evil exists, and it exists in people that we trust. And she started to see herself as weak and inadequate, because she said, how can I be so naive and ignore all the signs and not see that coming? And she also chided herself for listening to the advice of others. And it was foolish advice mostly, because it was like, stay with him and he would take care of you financially. And that was not truly the case. So this woman is still in therapy with me, and we are resetting the framework of her life. Trust is something that's first being built in therapy, and then it would be extended to the outside world. I've gotten now to see the landscape view of her life. that she isn't just some naive woman walking in this world, but she has in fact have a destiny and a purpose far greater than the human journey she's been on. And I would say that to you today, if you feel that you've been had, that you've been blindsided, that people have taken advantage of you, and you have a general mistrust of the world and its people, and this has a trauma base, you heal the trauma, your mindset and your emotional life will become aligned as well. There is much to be hopeful about in healing. Thank you for listening. I will see you next time.